Number of COVID-19 cases in the state has now risen to 359. 44 new cases have been reported from Karnataka today. This is the biggest jump in Karnataka in a day. The biggest spike that we are seeing in terms of cases, 44 new cases being reported from Karnataka in a single day. This is the biggest spike in a day in Karnataka. Yesterday, 34 cases were reported, and today the numbers have gone up even further, with 44 new cases coming to light. The total number of cases has gone up. In the afternoon medical bulletin being released by the government of Karnataka, the information said 9 people in Bengaluru have tested positive. And more importantly, 7 of these 9 people also did not have any travel history and did not have any contact history as well, which means the health department officials are still trying to find out how they contracted COVID-19. My colleague Adarsh joins us live from the newsroom with more details on this. Well, Adarsh, this is the highest spike in a day we are seeing in Karnataka. Yesterday, 34 cases were reported in 24 hours, and now the numbers have only gone up, with 44 new cases being reported in 24 hours. Take us through the details.
Well, Pratibha, the medical bulletin as such will be out in just a couple of minutes. We'll be able to source that information as to what about the new patients. But yes, the dismal state of the numbers are only increasing when it comes to Karnataka. And now the only good thing is the death toll has not increased. But yes, the number of positive cases has gone up to 359. And we're talking about how in the last 24 hours or so, we have recorded 44 new cases, which is the single highest so far that we have recorded, because yesterday we had around 34 cases that were registered, and today it's 44. So one only hopes that this trend does not continue and the numbers only increase tomorrow and day after and so on and so forth. But what really stands out is in the medical bulletins that have been released so far for the day, except for the latest one that has been released, is the fact that you have a lot of cases coming in from Nanjangud due to the Jubilant Pharmaceutical Company. What also stands out is the fact that we just discussed the Chikkabalapura case where 3 people who went around giving ration kits, they tested positive, and we have 3 cases coming in from Malavalli of Mandya also. All of them are contact of patient number 171. At this point in time, we have just sourced that information as to how patient number 354 happens to be a 65-year-old female from Bengaluru urban, and yes, as you mentioned, it is a case of severe acute respiratory illness. But apart from that patient 354, the next 6 patients that we're talking about, 5 patients that we're talking about, that is patient number 355, 356, 357, 358, 359, are all from Belagavi. So let's just take a look at the details that have surfaced in the latest. So patient number 354, as we were just discussing, a case of severe acute respiratory illness, and at this point in time the patient is being treated at a designated hospital right here in the city. So that is patient number 354. So then you have patient number 355. So 355 to 359, it is all patients from Belagavi, and all of them contacts of patient number 127. Patient number 355 happens to be a 35-year-old male from Belagavi, and contact of patient number 127, currently isolated at the designated hospital in Belagavi. So patient number 356 is a 17-year-old male from the city, again a contact of patient number 127, also at the hospital at this point in time. Patient number 357 happens to be a 46-year-old male from Belagavi, again a contact of patient number 127. And patient number 358 is a 37-year-old male from Belagavi, again a contact of patient number 127. So patient number 127 in fact had a travel history to the national capital, and patient number 358 is a 37-year-old male from Belagavi. Again, the same patient who came in contact with him was the patient number 127. Patient number 359 is a 38-year-old male from Belagavi, contact of patient number 127 once again. So these are the new cases that have come to light from patient number 354 to patient number 359. One of them is from Bengaluru urban, while 5 of them are from Belagavi, and the what really stands out once again is the fact that almost all of the cases that have been reported today are due to, let's just say, 4 to 5 people, 4 to 5 patients. One of them is, of course, patient number 127 that we're just discussing as to how 5 new patients have come in from Belagavi because of patient number 127, and that's some damage done. So that apart, when it comes to Bengaluru urban, we're talking about how patient number 167 seems to have done quite a bit of damage. The patient number 167 has gone ahead and transmitted the virus to at least 6 or 7 of them at this point in time in Bengaluru. And that apart, you have also patient number 52, who has obviously, we're talking about the super spreader from Mysuru, and that person has also gone ahead and contracted the virus to a lot of them. So yes, it is, again, when we look at those look at that information that is on our screens at this point in time, what really stands out is that almost all of them have just one contact, that is patient number 127. So here's what will give a better idea. So it was one of the super spreaders that have been identified this time around from Belagavi, as to how patient number 127 has gone ahead and has infected patient number 355, 356, 357, and also 358 and 359. So 5 patients contacted patient number 127, and patient number 127 was the source of COVID-19 for these 5 patients coming in from Belagavi. So yes, it is stage 3 that we are talking about, community transmission, and these may be only a few contacts that we're talking about up until now. And one must be thinking as to who this patient number 127 is. Again, travel history to the national capital, 26-year-old male, a resident of Belagavi itself. So we're still trying to ascertain whether this person, this 26-year-old male, who happens to be patient number 127, had any link with the Tablighi Jamaat Nizamuddin event that took place in the national capital. But yes, travel history to the national capital. So that's how the case really pans out. Patient number 127 went to the national capital, came back to Belagavi, tested positive, and in the process has gone ahead and infected at least 5 people so far. That's what the medical bulletin has said. And one only hopes that it only remains at 5, and that the district officials do not trace out more contacts going forward, Pratibha.
Right. Adarsh, lastly also, the cases in Bengaluru and Nanjangud cluster are clearly rising, but also the number of cases being reported from Ballari as well as Belagavi have also gone up, which is quite a disturbing trend, since over the last few days the situation seemed to be in control, but now the total number of cases has spiked up.
Well, one possible explanation to this is that there is more contact tracing that is being done, especially in Ballari, and it almost looks as though it is because of one patient number 141, who's gone ahead and infected at least 7 people from Ballari. So it all really comes down to testing. Now we cannot say with full surety that patient number 141 has gone ahead and infected just 7 people from Ballari. So the more you test, the more number of positive cases really emerge. So that's what it really comes down to. And probably had we done these tests a little earlier, maybe 2 or 3 days earlier, then we would have had these positive cases surface at that point in time. So it's all about how quickly you trace contacts and how quickly you test them, Pratibha.